Hi, I'm Sean Fulton, President of Self Advocates of Indiana. We are here today to talk about the COVID-19 and the new vaccine. In this video, we will be talking about what vaccines are, why they are important, and why you should get the COVID vaccine if you are able to. The vaccine is an important step to ending the pandemic. As self-advocates, it is really important that we take an active role in making our community safer. We all need to come together to be part of the solution.
Hi, I am Melanie Cooper. I experienced with the vaccine with the COVID is very just like common. I live here in the low block assisted living. And for 9 months, from March to November, we were not even allowed to go out. If we went out anywhere, we were quarantined when we came back for 14 days. In June of last year, I lost my mom. At that time, I didn't know what hit me. It felt like a ton of bricks because here I was and I was not able to travel. My mom and my family lived on the East Coast. I couldn't go home. In November, rolling on. And here was a man that I had loved, my husband, for 15 years, caught the COVID. I never forget the day that he caught it. But seeing Joe in a position like that, that was hurtful for me. In November, they opened up the doors for 2 days. After being in here all summer long, all spring, they opened up our doors for us for 2 days. Able to go and be able to attend Joe's funeral and take care of the business that I needed to take care of for him. But after that day that I came back from burying him, I have not been able to go out the doors. I just leave this building since. That meant that I did not have Thanksgiving with my family. That meant that I didn't get to see my family over Christmas. And I didn't get to see my family for New Year's. And at this rate, I don't know when I get to see them. I think about the coronavirus episode that really, I didn't think it would last that long. I heard them talking about it, but I'm thinking, okay, this is going to be 2 or 3 weeks, maybe a month or two. But now, as we are into 2021, and here we are, don't know if it's going to be another year like last year or not. The vaccine is coming to Roadblock. I don't know when, but God is good. It's going to be here soon. And when it comes, I really want to take it. This coronavirus can kill a lot of people. A lot of people that I know, a lot of people that I have loved and opened the door. It's really messed them up. And I encourage everyone to take it. Do whatever you can to get well because we don't want another year like last year. I know I don't. Yeah, get the vaccine. But most of all, be safe and be healthy about it. It's not an easy feeling. It's not a good feeling to be locked up in a building and can't go nowhere, can't go shopping. It's hard. Trust me, it's hard.
What's a vaccine? A vaccine is medicine. It protects you from getting sick. It uses your body's natural defenses to make your immune system stronger and build resistance to certain infections. The government and healthcare professionals work hard to make sure vaccines are safe. A lot of people are talking about herd immunity. What is herd immunity? Herd immunity is when there are enough people who are immune to a disease that it does not have anywhere to spread. There are some people in the community who aren't able to get the vaccine. Herd immunity is very important because it protects the people in the community who are the greatest risk, but who can't get the vaccine. It looks like the only way to stop the COVID virus is to make enough people immune so it doesn't have anywhere to spread. One of the best ways to do this is with a vaccine. It would take a long time, likely years, to just let COVID run its course naturally. A lot of people would die while trying to get herd immunity naturally. The vaccine is an opportunity to make our community safer sooner. People get the vaccine to stop people from dying. That's really what this is about. People with disabilities are at high risk of dying. This vaccine protects you, and it also helps protect your family and your friends. You get a vaccine to protect them as well as yourself. Right now, about 3,000 people are dying every day from COVID-19. That's like 9/11 every single day. That's probably more people than were in your entire high school every day, every single day. We've had about 100,000 people die in just the last 2 months. Vaccines keep people from dying. The more people who are immunized, the safer our community becomes. What if I'm concerned about how quickly the vaccine was created? Some folks are worried about how quickly the vaccine was developed. The good news is that COVID-19 virus is only one of several coronaviruses. It is part of the same virus family as something called SARS. This is spread a lot in 2003. Scientists and doctors started working on a vaccine for SARS back then. They've been studying that virus and working on the vaccine for 17 years. Because the viruses are part of the same family, they are a lot alike. Scientists were able to use the information they learned and the vaccine they created for SARS to make the vaccine for COVID-19. They were able to make small changes to the vaccine that they knew was safe so that it could work on COVID-19. Should I get the vaccine if I've already had the virus? Talk to your doctor or the Indiana State Department of Health to know for sure, but likely yes. We don't know how long immunity lasts for COVID-19. So it's probably a good idea to get the vaccine. Just talk to your doctor. There have been some documented cases of people getting COVID-19 more than once. What else should I know about the vaccine? The vaccines we currently have will need 2 shots. Do not forget the second shot. Make an appointment when you get the first shot and have a plan to get the second one. Vaccines are not instant shields. It will take a few weeks for the vaccine to work with your body and build up immunity to the COVID-19. You should continue to wear your mask and social distance in public until the Surgeon General and other health professionals say it's safe to stop.
Hi, I'm Berger. I am the Secretary of Self-Advocates of Indiana. Today, I would like to talk to you about the COVID vaccine. We all know how COVID has changed our life in the past year. But the good news is that we still have the vaccines available to help stop the spread of COVID. It is very important that people who get the COVID vaccine do so. There will be people, though, who aren't able to get the vaccine. Children under 16 can't get the vaccine yet because they are still testing it on kids. People who have a weaker immune system and other complex medical issues like cancer, autoimmune disease, and arthritis might not be able to get the vaccine. These people need to talk to their doctor to find out if they can get it. If you think you might fall into one of these groups, you should talk to your doctor about the vaccine. We're all a little different, and your doctor will be the best judge of whether the vaccine will be right for you. There is a lot of information and misinformation about the vaccine going around the internet. The best way to know the truth is to talk to your doctor or go to the websites of Indiana State Department of Health or Centers for Disease Control. If you see something on the internet, make sure it comes from the state of Indiana and the CDC directly. People can post all sorts of things saying it came from someone you can trust. Making sure by checking the real website directly or talking to your doctor. Remember, Facebook is for keeping up with friends, but it's not good to get reliable information. To sum it all up, everyone who is able to get the vaccine should get the vaccine to protect themselves and those who can't get the vaccine. As self-advocate, it's really important that we take an active role in making our communities safer. So, from one self-advocate to another, I want to encourage you to meet with your doctor to find out if you can get the vaccine. Thanks for listening and continue to stay safe.
If you have any additional questions about the COVID-19 vaccine or whether it's right for you, please contact your primary care provider, the Indiana State Department of Health, or the Centers for Disease Control. You can also call the ARC of Indiana for non-medical questions. Thank you and be safe.